Hi, today I wanted to talk about how to assess if you have DSR and how much of a gap it is in the lineal alba. So the first thing is I don't want you to get hung up on the distance of the gap, right? Do I have a 2 finger, 4 finger, 10 finger, and then totally freak out about it? This is just kind of assessment, one to see, how much it is, and whether it's functional or non-functional. And I've done, I've done different, we could just YouTube it and you've seen, or maybe you've already done this test before. I always just kind of measured here and only ever had really a 1 or 2. And the assessment that I've learned is a little bit more in depth, and actually I was kind of mind blown away that I actually have a 4 finger because I didn't actually go down all the way. So getting into this position, we want to do what's called the sexy slide, just like that, right? And the reason that we do that is when we go down, we want to take out any pressure that would come forward, right? So when I come down, I don't put any pressure. But if you look here, and this is usually how I used to get into the laying down position, is we're used to coming down like this, right? And notice when I come down like this, I start to dome through here, right? Because the pressure is being put on, and then my organs are being pushed out and down, and essentially that's kind of what leads to pelvic floor issues, leakage, lower back pain. So anyways, sexy slide it down, and we don't show our partner this because then there might be more babies. So lay down nice and flat, and the way we want to assess it is we're finding that the center of the center here, right? And we kind of all know roughly where that is, but right center where your navel is, and that's called the lineal alba. And the abdominals essentially are here, right? The transverse abdominis, and they have like a connective tissue that comes through the center of them, right? During pregnancy, we go like this, right? So it gets pushed out and it gets stretched out, and then obviously there's this space in between, right? So we have more room for baby. But what happens is that oftentimes that obviously doesn't go completely back together, and there's studies saying whether or not it completely goes back together, they're not really sure. And really, again, the research is saying it doesn't really matter. That's whether it goes back together. It's how you can function optimally in the core, so that you don't have dysfunctions in other areas. Right? Makes sense? So we take our fingers and we start at the top, and what we're doing is we tuck our chin in and we just very slowly lift the head up, just slightly off the ground, and we're feeling for the 2 sides hugging your finger. So if you can feel that with one, right, being hugged in, then that's it. If you can't feel it, you start to add in another finger. So I know up here, I felt a little slight something, but a little bit more. There we go. So I'm about 2 fingers up there, and then you start to work your way down, and you keep doing that. So again, slight lift. So with 2 fingers, I can feel the hug, right? I know personally my biggest gap is here, right? So just kind of the navel and below. So I'm going to go down there, and I'm going to use my 2 fingers, and I tuck my chin in and lift. Now I don't feel my fingers being hugged, right? Like a nice little hug to the fingers. So I'm going to add in another finger, 3 fingers. You kind of just got to poke it in there. And then again, slowly lift off. I kind of feel a light hug, but they're not snug. So I'm going to add in another finger. So there's 4 fingers. And then when I lift, I feel that hug, right? And so you're going to keep doing that until you feel that hug this way with your fingers. And I'm going to take my 4 fingers and I'm going to move down again. And same there. Actually, it kind of goes a little bit back to 3 there. And then just above the pubic area. And that is, I'm feeling more like 2 fingers. There. Right, so I know my biggest gap is right here, and that's normal, right? Again, just think about how, like, where your baby sat, or is sitting, and I'll show you in a second if you're pregnant how to determine DRA, and because you're not going to poke your belly, but the baby sits there, right, and then it pushes, right? So that typically is where most women have that space is right around here, right? Because that's been pushed out. Now, to determine whether it's functional or non-functional, we're going to do the same thing. This time we're going to do a Kegel while we do it. So a Kegel, pulling up through the pelvic floor, right? And so you got to think about, you know, do you have some imagery? Sometimes people like to use imagery, like I'm lifting a blueberry, I'm picking up a blueberry with my vagina, or a tissue, or whatever it is for you. Just think about doing that Kegel, right? We're not bracing the cord, you're stopping the flow of urine, right? So we're going to go back, and you might have to close your eyes because you have to really, really feel for this one. So again, you're going to breathe in, and as you breathe out, you're going to do your Kegel, and then you're going to lift to feel that hug. Now this time, if you lift to feel the hug, you should feel a light push on the finger, right? So you're going to feel the hug in and a light push. It's not like pushing out, it's just kind of like it's something. And again, you might have to do it a couple times so you get what it feels like. So breathe in, breathe out, do your Kegel, and then lift. Good. And then trying it maybe where the biggest gap is. So breathe in, and then doing the Kegel at the same time as you lift. Good. And so it's a little bit weaker for me down here. So what that means is that if you can feel that light tap, it means that you're functional DRA, and so that we can engage the pelvic floor. If you don't feel anything, you know, try it again, or you know, this is where pelvic floor physios come in, or if you really are concerned, you know, you can reach out to me, and if you're in my area, I can do an assessment as well. So this is just kind of giving us a guide whether we are functional or non-functional through the core 4 in this gap of the DRA, right? Yeah, so that's how you figure out if you have a gap and how big it is, and whether it's functional or non-functional.